Well, hello everybody. Today we're here with Dr. Chaffoo again. Thanks
Good
for
to see
having
you,
me.
Patrick. Thanks for
And
coming.
we're going to do something on me.
Exactly.
I mean, last time we came in here, we did an amazing job. We repaired a breast augmentation. Turned out beautifully. You're one of the best surgeons in town, as we know, or if not in the world. Triple board certified. Taught us a lot. Now you're going to teach us a lot about hair transplantation.
Right. You know, the big thing about hair transplantation, Patrick, is it's a really exciting field because if you think about when a patient chooses to have an aesthetic procedure done, hair surgery is one of the most critical procedures for a patient because it's permanent. It's something you can't cover or hide. And so how you design a hairline, the team that you have that work with you, the kind of devices that you use is critical in achieving an aesthetic result. We've all seen, you know, like we've all seen bad plastic surgery. Oh, yeah. We've all seen bad hair surgery.
The hair plate looks like a doll.
And it screams. You know,
Exactly.
I tell patients, you know, great plastic surgery whispers, bad plastic surgery screams. Nothing is more true for certainly in hair surgery.
Now, I have had this procedure done before, but it was a different type of procedure.
Correct.
And they did a great job.
I think your hairline was very aesthetically placed. I think that was a good decision. The issue, of course, we talked about a little earlier on is how do you harvest the grafts that you need,
Yes.
and where do you place those? So the first part of that people don't think about so much, but it's as critical. How you harvest the hair is how you plant the hair. And the older techniques, unfortunately, that are still in many of the kind of outdated clinics, are the use of a strip technique.
And that's what happened to me.
Yes.
And I'm literally still numb.
Yes.
In that spot. And you said that's never coming back.
That's permanent,
Yeah,
unfortunately.
I think I did it like 10 years ago or something.
Right.
Yeah.
The thing about our practice that's unique is we have the top people that do this procedure that are trained by the actual company that developed the device.
Okay.
So the hair team that we have are actually certified by the company. They have to have special hands-on training. These ladies have been involved in literally thousands of cases for a number of years. So you're in great hands for sure.
So I guess we get started by just trimming the back area and blending it in. Well, we're back. It's the next day. In fact, it's like not that far along. It's only been a few hours, really.
Exactly. So what we'll do now is we'll just go ahead and take off the band dressing here. It's just a little pressure dressing, really kind of for the donor site on the back in case you get a little bit of drainage overnight. Some people do, some people do not. You can actually see that the sites where the grafts were taken with the Neograft, very, very small openings where the individual follicular units are extracted, but there are a large number of spaces where your normal scalp and the normal follicular units were left intact. And the reason we do that is obviously we're sparing a large area of the donor region. The little holes that were made that are literally under a millimeter, they'll just actually collapse down and the surrounding follicular units will collapse in, and so we won't see any scars. So in the frontal area here, this is where the grafts have been transplanted into the frontal, a few in the crown area as well, and you can see some small little crusts that have occurred at the base of the where we place the follicular units between that and the scalp. And so you can see these small little crust areas. Those will be gone within about a week. When that grows, basically, you'll notice that the hairs will initially may begin to grow for a few weeks, and then that small little hair that was with the follicular typically will just fall out, and it will begin.
Don't worry.
Don't worry.
Because that's what people freak out, right?
Exactly. That's kind of what we call shock loss or telogen effluvium is the medical term for that.
When will they come back next?
Then I'm going to see in about a week. We'll see how things look in a week. In about a week, most of those little crusts will have flaked off, but we'll have to examine both the donor area and the recipient areas at that point.
Sounds great. I'm excited. Well, thanks so much.
Yeah, my pleasure.
Thanks again.
Looks good.
It's great. So guess what, guys? We'll be back in about a week, and we'll see the results. And so far, I am so impressed.
Great.
Thanks so much. Well, we're back here with my favorite triple board certified cosmetic surgeon, Dr. Chaffoo, and I'm doing good, right? When I tell people that I had grafts done, they're like, you did not.
Exactly.
And how long ago? I go, what, a month ago. They're like, are you kidding me? And they go, let me see the back. They're like, there's nothing. I go, yeah, there's nothing, absolutely nothing. Like nothing ever happened.
I know.
as opposed to,
The strip technique.
horrible.
Yeah, it's no comparison between the two. And in fact, the thing that's amazing about this technology, Patrick, is that really at about a week, as we saw in an earlier segment, the hair's already growing into the donor site, so it's hard to even know that anything was done even at a week.
It's crazy.
Yes. Basically what we're looking at right now is this hairline here. You can see where the transplants have been done in a nice irregular manner.
Yes.
So look very natural, but all the crusts are going away. But again, what we've done is just to recreate a very natural and unoperated on-looking hairline. So when the hairs grow back into the scalp, they'll be growing in a very natural direction, and he'll just have more density in that area. Then up in the whirl in here, there's the crown area. Again, we can just notice the small little areas where the grafting is being done. We can actually feel the little stubbles of the hair follicles there. But again, nicely packed very tightly and densely into that area.
The process is going according to plan. I'm very comfortable with it, and I just can't wait to see the final results. And you say, once again, that's going to be fully about a year.
Yeah, about a year, 3 4 months, exactly.
Exciting.
Yeah, me too.
So I'll see you in about 3 months, huh?
Forward to it, Patrick.
Yeah, and there we go. Well, we're back with Dr. Chaffoo. How's it going?
Good. How are you? Good to see you.
Yeah, it's been a while, huh?
Yeah, a little while.
How have you
Time
been?
flies. I've been good. Yeah. How about yourself?
Doing rhinoplasties
Yeah.
and breast augmentations and you name it, huh?
Right.
Cool sculpting, which we're going to talk about in a little bit.
Yes.
But you're still focusing on the hair restoration. How's it
Yeah,
doing?
it's really good, Patrick. The issue is it's been a hard problem for men to find out what to do for hair restoration. There's been a lot of technology, but a lot of people don't understand the best types of technology out there. And what we found is that the Neograft technology is really superior. We don't see a scar in the donor area. Healing is very fast, recovery is quick. The thing about our practice that's unique is we have the top people that do this procedure that are trained by the actual company that developed the device. So the hair team that we have are actually certified by the company. They have to have special hands-on training. The technology has advanced to the point where it's very minimally invasive. We have better graft survival. The procedure is shorter, easier on the patient. And in the end, it's about the patient's experience and their outcome that matter the most. And hair restoration, really, Patrick, I think is the most exciting area, one of the most exciting areas in aesthetic surgery, because people don't realize how critical an aesthetic procedure hair replacement is, because again, it's a permanent procedure. Once you've done something, it's done for good. And so the technology allows us to be very accurate, and we aren't replacing one problem with another. The nice thing with Neograft is it really gives maximal preservation of that donor area, allowing us to go back.
I had the strip technique, and I had, of course, a visible scar.
Yes.
And the donor area, people do not believe me.
Yes.
When I tell them that I've had something done. They said, well, where's the scar?
The nice thing about Neograft is we're actually able to go in and do Neograft restoration to restore hairlines. We've had women that have come in that have had a facelift where the hairline may have been elevated. There might be a scar on the back of the hairline. So now what we're able to do is this hair restoration surgery and naturally replant the hair to grow the way it would normally grow in the scalp. So basically, if you just look back in this area in here, and you just look at all the hair back here.
That's where my previous scar was.
Right. You can't really see any noticeable scar from the Neograft. And the Neograft procedure basically involves this entire area back here where we harvest from. A strip procedure harvests hair from a limited area. And so when you make an incision for a strip procedure, you're taking out a portion of that scalp and you're bringing the scalp together, oftentimes under some tension, and it's that tension that causes the scar to be noticeable. It will oftentimes widen, and then you lose hair on either side of it.
There's a lot of tension here when you move, and
There
the
is.
scar can start off very small,
Yes.
but over time it can actually expand.
Absolutely.
The other thing that I wanted to mention too, because you had mentioned to me about the survivability rate of the follicles themselves once
Yes.
they're removed,
Yes.
and the difference between having a machine. There's machines that do this technique as well.
Correct.
And you preferred to have an individual do this.
Right, because I really believe that that hair restoration surgery requires good hand-eye coordination. There's a certain artistry to it. What I like about Neograft is it still involves a skilled hand, an artist's eye. You're never going to really replace the human hand and eye and brain with a machine or a computer. Portions of that might become mechanized or computerized, but the overall process will always be patient-centered and physician-centered. And the nice thing is that when the grafts are harvested, they immediately go into a saline bath, a whirlpool bath, where they're kept nice and moist and they will prevent desiccation or drying out. My personal feeling is that with a strip technique, you're taking out a large area of scalp. Sometimes that will dry out, and then you have to manipulate that by, dividing it multiple times. There's more trauma to the follicles versus removing the follicular units where there's less trauma.
Right. And it's a pretty simple process. I know when I came in, it was a day-long process. I literally took no pain medication. Yeah, when I came home, I ate a little food, and I felt fine. I was impressed. I was expecting, because of the previous surgery, that I was going to be in pain for a week or two.
Exactly.
And the healing process in the back area was, I mean, literally, people could not tell that I had anything done within 4 days.
Right, and I'd say normally we'll say like 4 to 7 days, because at that point in time, everything's healed in. It's really great technology.
If you want to show the folks, you can show what you've done.
You can see that basically, if you look very closely, it's really impossible to distinguish the transplanted hairs from his natural hairs. And so it looks completely natural. And the follicles that were transplanted into Patrick's hairline will remain there permanently. So were you to lose more hair at a later point, that hairline is established and will remain there.
It's wonderful. And the hairline itself is so well placed.
Yes.
I mean, the direction of growth, everything. I mean, I'm telling you, people, I literally have to show them the video. No, this is hair transplants. They're like, okay, give me his number. And I've sent many people to you, and because you do a great job.
Thank you.
Thanks so much.
Thank you. Good to see you again, Patrick.
And thank you so much for being here with us. And until next time, just remember to enjoy.